Hello and welcome, I'm Chaiti Narula. Today's special broadcast focuses on the prevention of suicides. What are the kind of telltale signs that you should notice amongst people who are perhaps ideating suicides, and what is the psychological first aid that all of us can provide to give them hope that they need at that point of time? Suicides, remember, are preventable. Mental health needs to be spoken about more like this, the way we are talking. And normalizing conversation around it is imperative. And that is exactly what we are constantly committed to do, in the hope that many come out and unmute themselves. Outside of mental health, economic policies can help provide financial security to those feeling hopeless due to financial reasons. And that is a hugely underrated topic when it comes to suicides. Let's join hands in creating hope, hope through action and plausible solutions. First, take a look at my report.
Every 40 seconds, someone takes their own life. Every 40 seconds. Let that sink in. This makes it approximately 800,000 people every year around the world. Suicide is a global concern today, especially in the pandemic era. A serious public healthcare issue and a call to action is now gaining ground more than ever before.
Lots of stresses most of us have experienced. Loss of a loved one, quarantine, lockdowns, being indoor, pressures of various kinds of job, economic especially, schools, colleges, uncertainty, all of this has had an impact on us. It's very important that we realize that this is the right time where we'll start looking at policies towards mental wellness of the society.
The International Association for Suicide Prevention observes September 10th every year as World Suicide Prevention Day. This year, the theme is creating hope through action.
Each and every individual, every member of the community can play such a significant role in ensuring that we can prevent suicides, especially for those people who are around us who may be struggling with certain experiences of their life, with mental health related issues. Hope can be created through every small action, whether it is showing your compassion, your understanding.
According to the IAPS, over 75% of suicides take place in low and middle income countries. That begs the big question. Apart from mental health, shouldn't the focus also be on economic hardships and financial turmoil? After all, these are also contributors to this global conundrum. There is now a need to spread more awareness about mental health, mental fitness, and very importantly, financial security. So what can governments do through policies to lessen the number of suicides?
The advent of suicides has become an extremely worrisome phenomenon, especially in the post-COVID situation. And I think we really need to take some very urgent measures from a government perspective to bring this under control. It is surely economics that seems to be one of the key drivers of suicide.
Policies that are focused on decriminalizing attempted suicides, like the one in India, help in achieving the objective to reduce the numbers. Mental health practitioners around the globe cannot stress enough on this. Suicide remains illegal in close to 25 countries worldwide, and attempted suicide is punishable under the Sharia law in close to 10 countries. The WHO has urged countries to review their legal provisions in relation to suicides to ensure that they do not deter people from seeking help.
In 2017, India realized this and decriminalized suicide. In fact, the message was sent across loud and clear that people who are trying to kill themselves are not criminals. So it is important and imperative to provide each one of them with proper mental health services. India has taken a step in the right direction.
Suicide prevention is the need of the hour. Understanding it is okay to not be okay is key. Opening up to a mental health care practitioner should be normalized. Even celebrities come forward to address this.
If you're not going to be okay up here, it's not going to translate down there. So, by all accounts, that makes complete sense. See, the reality is that it's okay to not be okay.
Yeah.
It's absolutely fine.
Yeah.
Every person has moments and beats in their lives, in their life, where they go through a lot, and it might retrospectively hit you. So when the lockdown did happen, I was emotionally broken because a lot of things hit me. That was the first time I was able to pause and reflect. And I had a partner I could rely on. I had a sister I could rely on. I had enough support system within the house. Even if I had to break down, and emotionally breaking down for a man is perceived to be "tum mard ho." How can you showcase emotion?
Economic policy experts cannot help stress enough as to how policies can be fine-tuned and tweaked across nations to help prevent suicides. Not just that, depression is one of the leading causes of suicides all over the world, and decriminalization of suicide is the step in right direction for countries to adopt, like we did in India. Mental health care practitioners insist on unmuting yourself. If you are going through any kind of symptoms of depression, do not be afraid to unmute yourself and reach out to a qualified mental health care practitioner. If you see someone struggling, go ahead and lend a ear. After all, suicides are preventable. Let's all join hands on World Suicide Prevention Day 2021 to help save lives. In New Delhi, Jayati Narula for India Today.
And joining us now to discuss this very important topic, Dr. Sameer Parekh, Director, National Mental Health Program, Fortis, Dr. Jayajit Bhattacharya, an economist, Dilip Chenoy, the Secretary General of FICCI. I thank you very much, all of you, to take the time out and join us today. Let me begin straight with Dr. Parekh. Dr. Parekh, what are the telltale signs of someone ideating suicide, and how can we as regular citizens, not doctors of course, offer psychological first aid? I believe we all have a role to play to address that, and after that direct them to a professional. But that first aid and intervention is absolutely crucial. If you could guide our viewers.
Absolutely. I think we need to understand that if anyone around us is feeling vulnerable, how will it come? It will show in terms of change of behavior, maybe withdrawing, irritable. It may come across as change of mood, sadness, individual talking about life's not worth it, talking about dying death, not doing the day-to-day activities, avoiding friends, and a sense of hopelessness or worthlessness coming in the conversations. We should look for this, and we should also look for people who've gone through major changes and stressors, loss of a loved one, loss of job, economic hardships, and having any mental health concerns. These are the flags for all of us to identify, and the first intervention is us, which means you don't need to be an expert, but a friend, a family member, a colleague, a neighbor. And that's where you give the psychological first aid, compassion, support, and most importantly, be there.
Right. And also, Dr. Parekh, there are a few telltale signs that you would observe, like, they would start closing in their accounts, adding a few nominees and beneficiaries, the manner in which they start speaking, where other people perhaps start getting irrelevant to them, or they get into their shells. If you could just elaborate a little more on that for people to understand that, look, this person may be struggling either through clinical depression or any kind of mental health issue, or perhaps ideating suicide.
Yes, I think one needs to understand that change in behavior, which largely would be about withdrawing, or can also be about planning for time when I'm not there. It could be closure of finances or doing things, planning for family and others. Those kind of behaviors, talking a lot about dying and what happens after and how it is hopelessness, and talking about that, I don't feel that I would wish to continue. Those kind of conversations happening in change in mood, avoiding people that one likes doing, avoiding activities that one likes doing, going more into a shell, These kind of changes, when they start happening, especially when you also have, like I mentioned, any mental health issues in the past, and that's something we need to understand. We all focus so much on the proximal factors. Proximal is what happens around the suicidal episode. What we need to understand is that the vulnerabilities happened a long back, which are the distal factors. When those factors make us vulnerable, that's when the immediate stressors have a more disturbing impact.
Absolutely. So, our antennas need to be up as society, and all of us need to watch out for these signs that Dr. Sameer Parekh has spoken about. And psychological first aid intervention is absolutely key. You don't have to be a doctor. You and I can do it. Dr. Jayjeet, economic paralysis globally leads to a lack of financial security, and now more so given the financial distress post the pandemic. What can nations around the world do with policies to ensure social and financial security to prevent suicides taking place due to financial hopelessness? There's a sense of hopelessness of anyone who's even ideating suicide, given there are more cases of this that are coming out in the post-pandemic era.
There's a lot that can be done, both at a policy level. So at a policy level, we need to make sure that institutions which are involved in financial transactions should be keeping track of the people that they're lending out to or whose finances they are managing. There is no such policy or there is no such regulation which enables institutions or forces institutions to keep track of the financial health of their clients. If you have lent to somebody, and you pretty much know what the income of that person is, and if you know that that person has lost their job or have lost their ability to earn, then you pretty much know that that person would be in financial trouble. Are there any institutional mechanisms to report it back to the concerned authorities? For that matter, are there any concerned authorities? Is there any authority which is concerned in that sense? Do we have a community built up? And it's related to the previous question you were asking, what is the telltale signs? And for people around a suicidal person to understand that person is having those thoughts, is the community having the ability to figure out that somebody in their community is having a suicidal tendency, and therefore how to provide what you called as a first aid for this particular person. Now, we don't have any of that put into place. We don't have it in our school curriculum, in our education curriculum. We don't have a policy by which financial institutions are responsible to find the financial health of their clients. And more importantly, especially in India, we don't have the equivalent of what is called a Chapter 13, or for that matter, a Chapter 11, which exists in US, where till almost about 4 crores of rupees, or the equivalent of 4 crores of rupees, one is allowed to restructure their debt. And financial and economic reasons are one of the primary drivers for suicide. And therefore, can we alleviate some of these problems by adopting regulations such as the Chapter 13, which allows restructuring of debt till about 4 crores of rupees, and for larger amounts, Chapter 11 kicks in? Can we have those provisions so that people can roll it over and use their future income to be able to pay off for these debts, and thereby also contribute to the GDP in that sense? But more importantly, it's a survival of the person.
So this is very important for the lawmakers to listen into the kind of regulation that needs to set in for financial security. The other thing also is about social security when it comes to the below poverty line, or when it comes to a certain strata of society. Are you happy with India's social security measures? Because hopelessness, of course, comes from the fact that I don't have 2 square meals to eat tomorrow.
So we have taken steps, but we are still at an infantile stage in terms of social security. There's a very small layer of people who are getting social security, and it's a very distributed social security, in the sense I'm giving you free gas, I'm giving you some work against which I'll pay you, and so on and so forth. But typically, suicide happens when you have taken a large amount of debt. And you have the ability to sustain yourself in most cases, but you don't have the ability to pay off the debt and everything else that comes along with it. And therefore, from the question that you asked about a social security framework, lot needs to be done. Lot has been done. I would not take away what has been done.
Yes,
I think we have made considerable steps in that direction, but a lot more needs to be done. And the institutional structures around that social security has to be built in. And the other point I just want to add is that if we ignore deaths due to suicide, it's almost a white-collar crime that we're committing. It's a white-collar murder we're committing, because society is the one which is actually forcing this person to commit suicide. And we are aware of those telltale signs, as you had mentioned, with the previous panel person. And we also have institutions which have the ability to monitor that a person is getting into financial distress, and therefore, in spite of that, if you're not taking any steps, it's equivalent to a white collar murder.
You know, you're very right on that front as well. And India has taken the step in the right direction in decriminalizing suicides. But I'm going to come back to that in just about a bit. Dilip Chenoy, is there enough intervention by India Incorporated on mental health of corporates? Why is it that workplaces till date are unable to destigmatize mental health and use it like some sort of a handicap against employees? Can there be more empathy? Is India Incorporated doing something about it or aiming to do something? Is there anything in the pipeline?
So I think, Chati, if you look at the whole corporate structure, there was a pre-COVID era and a post-COVID era. So a lot of what, the kind of challenges that you faced in the pre-COVID area and if you like to say, the non-recognition of this as a major challenge and putting processes and systems in place to deal within the corporate, perhaps were not that inbuilt and ingrained in organization. But during the COVID period, and especially with this whole thing of remote working and different aspects, I think all levels of corporate India are looking at how to really, engage with the workforce, engage with all their colleagues and partners in the whole ecosystem. In some cases, it's even spilling over to, the whole vendor and supplier and, customer, thing. And I think they're following a very interesting thing because earlier, they were not even professionals who were actually being able to, do this. And it was not, normal for a corporate to have a mental health specialist come in and talk to people and, have this. I think during the COVID pandemic over the last 18 to 24 months, a lot has happened. People are looking at identifying issues, looking at providing psychological first aid, looking at making family parts of the program. And, one interesting aspect of this whole digital phenomena is it's very easy to make families part of the whole ecosystem. So town halls are actually extending to families. And a lot of them are removing the whole taboo against mental health. In fact, a lot of them have, got into agreements with professional home care and healthcare providers to actually include mental health as the package of services that they provide.
That's what I was about to come to actually, Mr. Chenoy. When it comes to healthcare system and the ecosystem, you do not see too much of mental health assessment that is being done, but there is only private sector is restricted to physical assessment. For that matter, even public sector. Do you see some sort of a PPP model going forward, or the private sector at least stepping up to incorporate mental health assessment as a part of routine so that people realize that this is also as you have to take care of your mind as much as you do for your body?
Yeah, Chati, within FICCI we have a HR group. And one of the major conversations has both public sector and private sector, traditional companies, new age companies, all of them in the group. And this has been a great focus of all the HR professionals, irrespective of that, and learning what others are doing, sharing. And I think one thing which has happened, earlier you would not get a group of HR managers getting onto a Zoom call and, talking to everybody and trying to get the best thing. They'll wait to get together. Now I think the communication has improved, the awareness has improved. People are picking up best practices. People are saying, who are you using? How is that? How is that person? How is that institution? Can we also reach out to them? So a lot of sharing, and it's like it's actually gaining momentum as we go forward. And I think it will be an ingrained part of the the human resources strategy of most companies actually to ensure that the mental well-being of people is there, because it's been actually realized that this is a great great dampener to the organization culture, to productivity, to efficiency, etc.
Absolutely. And it's commendable that India Incorporated is taking the step in the right direction. Dr. Parekh, countries around the world, should they review their legal provisions, pick cue from what India has done and decriminalize suicides immediately? Don't you think that is the need of the hour, given the fact that you have criminalization of attempted suicide? It is known to undermine suicide prevention effort and deter people from seeking help or impending access amongst vulnerable people. It ends up doing exactly the very thing it stands against.
Absolutely. In fact, I think the decriminalization of suicide was an absolute landmark milestone in Indian history when it comes to mental health. Then the Mental Health Act coming in. I think now we need to have more and more insurance sector coming in. I do appreciate what Dilip Chunai was saying, and I do feel industrial and corporate houses need to integrate mental health as an integral part of their system, and mental health outcomes have to be one of the measurements for all organizations beyond everything else that we do. And you've been talking about social and financial security that can only happen when microsystems stand by together, because everything can't happen at a large policy level. Having said that, this is time that we all work together for a national suicide prevention policy and understand that stakeholders have to be there. Psychological first aid, mental health curriculum at schools and colleges, mental health outcomes at corporate level, integration of mental health at primary healthcare level using Digital India, because that bridges the divide and makes sure that the last mile connectivity is there, public-private partnerships, lots of helplines, role of media, utilizing social media for positivity and role models. You put all of this together, that's suicide prevention plan for the next decade.
Absolutely. Dr. Jaijit, on a winding note, more and more people are stepping up to treat mental well-being. They have a preconceived notion that good quality therapy is expensive. What can government today do to ensure that therapy, that is behavioral therapy that one may require, is available to the least common denominator at an affordable price, given the fact that this is now becoming restricted to people who come from privileged backgrounds?
Absolutely. In fact, even when we're talking about corporates, we're ignoring the MSMEs. As per certain estimates, there are more number of suicides on a per capita basis with MSMEs than even with farmers. And therefore, a large number of people are not getting access to the mental health facilities. And also the quality of mental health facilities is a bit of a question. But having said that, we have a healthcare institution system where we have got the sub-centers, the health centers, the primary health centers, the district centers, but hardly any of them are really geared up to support mental health problems. So if you can strengthen the existing health system and make sure that the mental health is a significant pillar within each of these institutional structures, starting from the sub-centers which exist at a village level to the primary health center and so on, it would provide a much more strengthened institutional framework for those who are seeking mental health at the levels that are needed, and not just at the privileged levels, but those who are underprivileged and do not have access to mental health. I think this is something that is that needs to be done both at the central government level and at the state government levels.
I'm so glad all of you all have spoken up about this whole multidisciplinary approach, where when it comes to India Incorporated, when it comes to a mental health professional like Dr. Parekh, when it comes to an economist like Jaijit Bhattacharya, this is so important, because this is our entire society coming together to address a problem with a plausible solution at hand. And more discussions like this will normalize conversations around mental health and hopefully save a life or two, even through one program. And that's our hope, maybe many more lives by reaching to many through this particular medium. I thank you very much, all of you, for taking your time out and joining us on this very important discussion. But before you go, we have a special message coming in from actor Arjun Kapoor when it comes to mental health. Leaving you with this.
Mental health is a real problem. It is not a joke. It is not something to be sidelined. It is something that has to be addressed. It is something that has to be respected. It is something that has to be part of our daily thought process. It's like if you go to the gym to take care of your body, you have to also find ways to take care of your mind. And if that means talking to a doctor, if it means talking to your partner, if it means just listening, if it means meditating, if it means going the distance to feel secure enough that you can share your deep, dark inner secrets and fears with a therapist. It is allowed. That is not something that makes you weaker. It is something that will eventually make you fly, because you'll be able to get rid of your insecurity.